Welcome to the Health Trip Podcast. My name is Jill Foose. I'm a functional medicine and integrative nutrition health coach. I created this podcast to bring you along as we travel down intriguing, science-packed roads, debunking old medical paradigms and perusing new innovative therapies and modalities with the finest functional medicine doctors, practitioners, and like-minded biohackers while living our best life. Enjoy the show. Hi, everyone, and welcome back to another episode of the Health Trip Podcast. Most women who enter menopause expect the usual, the hot flashes and the sleep disruption. But what nobody is telling women is that menopause is a window of increased vulnerability to some of the most significant disease states of their lifetime. Cardiovascular disease, which is still the number one killer of women, metabolic syndrome, autoimmune conditions, cognitive decline, osteoporosis, and cancer. The hormonal transition of menopause does not cause all of these, but it creates the biological conditions that accelerate their development in women who already have underlying vulnerabilities. And most of those vulnerabilities have been building for decades, completely undetected. So here's what I've come to believe after years in this space and from navigating menopause myself. The women who navigate menopause best are the ones who ask a hard question. It's not what am I feeling, but why am I feeling this way? That is the exact question that drives today's guest. Dr. Guillory is a board-certified emergency medicine physician and one of the first certified functional medicine practitioners in the state of Texas. He is the founder and medical director of Root Causes Medicine in San Antonio, a practice built entirely around one simple question that most conventional doctors don't ask: why am I sick? Dr. Guillory's path to functional medicine came from his own personal health struggles before the age of 17, which means that he came to this work not just as a physician, but as a patient who needed a different kind of medicine. And that combination of clinical expertise and lived experience is exactly what makes this conversation so compelling, especially for you and me who are navigating our menopause journeys. So just a short disclaimer before we dive in. By listening to this podcast, you agree not to use this podcast as medical advice or to make any lifestyle changes to treat any medical condition in yourself or others. Consult your own physician for any medical issues that you may be having. And this entire disclaimer also applies to any of my guests on my podcast. So sit back, open your mind, and let's dive into the world of root cause medicine. Hey, Dr. Guillory, welcome to the Health Trip Podcast.
Thank you so much for having me. I'm so glad to be here.
I am so glad to have you here because women who are navigating menopause often feel very disconnected from their body. And I truly believe you're the right person to talk to about reconnecting with our body and approaching things from a root cause perspective. But before we dive down that amazing path, I want to learn a little bit more about how you came to the space of functional medicine.
Well, thanks for asking. This is a great topic, and so glad that you invited me on. I was a patient long before I became a doctor, and I was born sick with irritable bowel syndrome. I got really sick as a teenager and began having seizures around age 12, 13. My IBS got much worse, and none of the doctors could help me. And I was pushed into the situation to look for the cause of my own disease, because when I asked, why is this happening? No one had an answer. And worse than that, they didn't even think it was important to ask that question. And they looked at me like I was crazy when I said, why am I having seizures? And so my own navigation of figuring out a complex disease, why is this happening to me, directed me into medical school and really gave me a love for being a medical detective and using that as part of my mission, which is to be an instrument of healing for people so that they can heal themselves, and then so they can become an instrument of healing for their family and their community. And that's how we heal the world.
But you ended up in conventional medicine for a long time as an emergency physician. And so what was it about being in that position that drew you even more towards starting your own clinic with a root cause approach?
Yeah, so my story is really interesting. It's a long story. I took the long road into holistic, or what I call root causes medicine. And part of that was intellectual curiosity, but also just I love taking care of critically ill patients and complex patients.
Mm-hmm.
And I was the guy in the emergency room talking to people about their food and about their exposures and about their emotional, spiritual, emotional health relationship to their physical disease. And chronic disease has gone nowhere but up in everywhere, including in the emergency room. And so I use that experience with those broad patients. So the broadest possible experience really happens in emergency medicine, young, old, critically ill, chronic illness. And using that experience really gave me an understanding for the causes of disease that we can back up far enough, from zoom out far enough, and we actually find the answer to the question, why are people sick?
Mm-hmm. Listening to your story growing up and asking the question, why is this happening to me? It sounds so familiar to many, many perimenopausal women. Even though the conversation is becoming more loud now, it's still recent. 10 years ago, nobody was talking about menopause. And
Hmm.
so the perimenopausal woman is going through all these changes in her body and thinking, oh my God, what is going on with my body? Like, I don't feel anything like I used to. And all these symptoms are arising. And she goes to her doctors, and her doctors just say, your labs look normal. And this is just part of aging, or we don't know what's going on. Now, of course, we do know, and more clinicians are becoming more educated about menopause care, but it really reminds me of your story and how many women are also going through this.
Yeah, it's a common story. I see patients all the time that have seen multiple doctors. And unfortunately, we really rely too much on lab work. And I'll never forget the first guy that really made this impression. I saw a patient who was 350 pounds, almost actually more, almost 400 pounds, a smoker and a sedentary lifestyle. And he was getting a bonus from his employer because his labs were all normal.
That's crazy.
And we put too much reliability on the labs. And
Yeah.
the most important thing is the story. If a woman comes to me or any patient comes to me and says, this is what's bothering me, I believe them. And it doesn't matter what the labs say because the labs are inadequate. They are incapable of telling us what's causing the problem many times.
Yeah, we're going to talk about the differences between normal labs and optimal labs, and physicians who like looking at labs versus physicians who don't think they're necessary in
Yeah.
certain instances. But I'm curious, what are the most common root causes you find hiding behind the symptoms that midlife women have been told are just menopause? Because the community here are midlife women and beyond who are navigating this transition.
Yeah. So the first thing I really want to my goal today, I will succeed if I help women change their relationship to their bodies and first learn that their bodies are not broken, that this is a big problem, but it's not because their bodies are somehow failing. It's the body is responding, the body is signaling something to us. So that's the most important thing to me, is
Mhm.
that women change the way they think about their bodies and they really listen. What is my body telling me? But the most important causes, if I simplify it as much as I can, and this is really, really important, the hormones going down, I believe, reveals the nature of the problem. It's less that the hormones are causing the problem, it's that they're revealing the problem. Okay, so this is a major shift
Mhm.
because the body is either intelligent and wise and serving my interest as the owner of this body, or it's not. And I believe the body is wise, and menopause is a normal function that's been happening for thousands of years. but many women struggle with it because it's revealing a major chemical toxicity, a major biotoxin exposure, a major immune system dysregulation that's being caused by an infection somewhere in the body, rather than just my hormones are going down. So that's probably the most important thing I want to communicate, is that the body is responding, it's signaling, and these problems are a they're a major underlying cause of significant disease, not just symptoms. So, the inflammation, the metabolic dysregulation, the degeneration that happens as a result of those hormones going down is much more of a signaling process telling us to look for the underlying cause of the dysfunction.
So I'm imagining like a cover on somebody, and the hormones that are declining are when the cover is being pulled back. And then, I truly believe everybody has their own health equation, right? We all come to the table with our own unique
Mm,
genetics, our family history, our life experience, our lived experience, our
so
nutrition,
true.
like everything's different, right? Yet when the cover of menopause is pulled back because the hormones are fluctuating and ultimately declining, so many women experience a lot of similar things. I mean, a lot of women experience different things too, but I'm just wondering, I'm trying to shift my mind to think how you're suggesting this because I haven't thought about that yet. Because when you're in menopause, you're just desperate to find a solution.
Yeah.
You are Your life has become unmanageable in many different areas, whether it's work, whether it's your family, whether it's your relationship, whether it's getting up and just being motivated to go do the things like eat, make good food choices and exercise and get to bed on time, all those things, right? But it's different for everybody.
Yeah.
And when we're in that zone of chaos, we just want to fix.
Yeah, and that's so true. So in my framework, when I see someone, I it's really important that we manage both symptoms and causes. So we
Mm,
never ignore symptoms, because just managing symptoms changes people's lives. So this is where hormone replacement therapy comes in. This is where some a targeted nutritional supplementation can really be beneficial. And we're managing symptoms all the time, right? But
yeah.
then that key piece is, why is it happening? Like, what is causing my belly to be so distended or big or uncomfortable? What's causing the sleep disruption and the hot flashes, right? So that's the really important part while we manage symptoms. So never ignoring symptoms, and then just thinking, why?
Yeah. So you also mentioned how there are these chronic disease states, right? And that when we pull back the dressing and our bodies reveal the toxicity or the chemical imbalances, we're vulnerable to all of these different
Mm,
um, diseases, these chronic disease states, right? So cardiovascular disease, which is the leading cause of death for women and men. We've got metabolic syndrome. We have cognitive decline. We have cancer. I mean, inflammation. So how do you look at all of that in regard to the hormonal transition and what the root cause, if you want to go one by one on these major chronic disease states?
yeah, so we can talk briefly about cardiovascular disease, since
Mhm.
that's so common. And again, we have to change the way we think about everything, because once you zoom out far enough, you see this, you can't unsee it.
Mhm.
So estrogen and progesterone, and also FSH and LH, they're very powerful hormones, right? They're immune system modulators, they're metabolic regulators, not to use too many huge words, but when you pull off estrogen and progesterone, you're not just pulling off the beautiful things that those hormones do, like support our brain and support our bones. You're changing the way the cells work and the way the immune cells work, including vascular cells and everything else. So
Right.
cardiovascular disease, this is a really important shift. It's happening for a reason. And the cholesterol particles that have been demonized by the conventional medical societies, they're not the problem. They're the solution to the problem because your liver is making, this is true of inflammation too. If your CRP is really high, if you're inflamed, the body is not going to be inflamed for no reason. It's inflamed for some reason. And many of those things are chronic infections from leaky gut syndrome, is what they call it, now. Infections from the microbes in our gut crossing the barrier into our bloodstream and into our tissues, and from chemical burden, creating reactive oxygen species in the blood vessels that's causing cardiovascular disease. So the hormones, progesterone and estrogen, are so powerful. They're like little magic molecules, and they can keep everything at bay, but they're not reducing the chemical exposure. They're not reducing the bacterial or parasite or yeast or biofilm exposure. Does that make sense?
Mm-hmm.
They're
Mm-hmm.
just creating this beautiful protection is somewhat, but they're not the cause of the problem. Does that make sense?
Yeah, it's not how I usually think. And I'm going to tell you, I don't think it's how my community usually thinks. So this is all
Yeah.
very new, like you said, but we're open-minded here. And so I've always, I've had a lot of preventive cardiologists on my podcast, and I've talked ad
Yeah.
nauseum about heart disease because I have the genetics for heart disease, and I do
Right.
take a statin and I take Zetia because genetically, these are the things that I need to take if I want to, um, live a long, healthy, heart healthy life. But what you're saying is it's not really the cause of the loss of estrogen, because we are told a lot on social media that as estrogen goes down, that opens the door to an increased risk for heart disease. But I think what I'm hearing from you
Mm.
is that it goes beyond that, and it's it's below that in terms of there could have been an infection or some type of other imbalance that's really the root cause of it.
Exactly. So it's both. The estrogen and progesterone are doing a lot of powerful things, but it's not just that. And there's the fundamental shift that happened in me many years ago where I had to ask myself the question. Cholesterol was one of the reasons this shift happened. It was actually in medical school because the liver makes cholesterol particles. The
Mhm.
liver is doing this on purpose, and the liver is sensing the environment and making a particle in response to the environment, right? And there are some people that need prescription medication, familial hypertriglyceridemia, familial hypercholesterolemia. Some of those patients really do need medication for that. But my experience is that there is something the body's responding to, not just the hormones. And in my experience, everyone in America, particularly, is overwhelmed with a toxic burden of heavy metals, petrochemicals, pesticides, plastics, forever chemicals. And from those chemicals are disrupting the gut barrier and all of our barriers, actually. So sinus, dental, gut, and also blood-brain barrier, and all the barriers in our endothelial barrier in our
Yeah.
muscular tissue.
Yeah.
Those chemicals are disrupting the barrier, and they're suppressing the immune system, which allows infections to take hold. And when I appropriately deal with chemical exposure and the inflammation and barrier disruption that's associated with that chemical exposure and infections, we see magical things happen across all disease syndromes. And it's not just restoring hormones that's essential for these women, it's thinking, what is the exposure? What's the cause of the inflammation? Not just the inflammation. I see a lot of patients that get anti-inflammatories, whether that's curcumin or boswellia or herbs, right? These are all great things. But what do you do when that doesn't affect the CRP?
Right.
and it stays up. I had a patient just this week doing all the right things at another functional doctor. Her CRP is still 8, which is pretty high. I mean, I've seen CRPs as high as 250, but CRP above 1 is abnormal. Above 3 is pretty concerning. Around 10 is really concerning, and hers is 8. Why is that? It's
Talk about CRP for a minute because we might have some listeners who are not familiar with CRP, and it is not on all of the annual panels that people get.
CRP is a really important marker, and it's a marker of inflammation and remodeling, not just inflammation. We also use it as a marker of infection because it's very specific. If your CRP is above 50, you almost certainly have a significant infection. So I follow CRPs in all of my cancer patients and all of my chronic disease patients because it's one of the first markers to come up if something changes. Um, but always there is a cause for the inflammation or remodeling. It's not just the body making CRP for no reason.
Right.
Yeah.
It's in response to something
It's
happening.
in response to something. And, progesterone is a really powerful anti-inflammatory, one of the best ones there are. So you remove that progesterone signal in patients going through menopause, and inflammation spikes through the roof, right?
Yeah.
But, and it's important for us to get that down. Sometimes we use progesterone, um, but it's as important to ask, why is it high?
Right. Plus, we're not replacing these hormones at a super physiological level either, right?
Right.
There's less estrogen and progesterone in menopause hormone therapy than there is in, say, birth control,
Right.
right? And I don't think women really understand that.
Oh, exactly. And I
Hmm.
use hormones, I mean, liberally because they're so powerful at very
Yeah.
small doses, particularly for symptom management, but also for disease risk management. And
Yeah.
our brain and our bones, particularly, and our blood vessels love estrogen, and we need it. And so I don't ever shy away from the hormone therapy, but I'm always a little bit obsessive compulsive about asking why.
100%. And more physicians should be doing that, right? And also, women need to be asking those questions too. I just wrote a whole blog on questions to ask your physician, right? That you might not be thinking about. I think that, in traditional medicine, the patient doesn't feel like they're allowed to ask questions. And, I coach my clients to come up with the questions they're curious about, write them on a piece of paper, put them on your phone, and make sure that you ask your top 3 when you're in your appointment, right? Learn about your body. And so, you're a physician who has this root cause approach and knows how to connect these dots, but women also need to be in a position to be able to ask the question to connect the dots for themselves too. So I really love the synergy here.
Yeah. I always want to empower people. So
Yeah.
I give people as much information as I can get and encourage them. Now with chat GPT and AI, patients come in well informed.
Yes. Oh, yeah. Yes. I want to pivot to metabolic syndrome because this is an area where women are really suffering in the menopause transition. We talk about the menobelly. Of course, that's not a medical term, but that's what it is. This menobelly all of a sudden appears out of nowhere. Women
Mm,
are doing the same routine, they're eating the same way, they're sleeping the same, they're exercising the same, and all of a sudden they've put on, 10 pounds. And then maybe in 2 or 3 years, it's 20 to 25 pounds. And it just keeps accumulating around our midsection. So,
mm.
talk about our root cause approach to metabolic syndrome and why women are really struggling to reduce that belly fat.
It's a great question. And the data is really lacking in this regard. So I have to sort of make a lot of assumptions. But really importantly, the gut is the center of our immune system. And anytime I see belly fat, any belly symptoms, I'm really curious about the gut. And The inflammasome, I don't know if people have heard this, or the metabolome, and all of these different ohms that all the influencers are using. This is describing this complex interaction of molecules in and around our cells. And the, the belly fat, I believe, is a direct response to the microbiome and the gut barrier struggling because of chemicals and infections. Because every time we breathe, that the chemicals in the air are getting pushed into our gut and they're flaming out our epithelium and our microbiome. And so for me, it is evidence of the problem. You remove that progesterone estrogen signaling, and now you've just revealed this major problem in inflammation, in infection, in chemical exposure, and gut barrier integrity. And when you repair that, the metabolism can get back to normal.
Is this why autoimmune conditions flare up for women in the menopause transition who have never had autoimmune conditions before?
Exactly.
Hmm.
Exactly. And this happens, it's not just menopause, actually. We see multiple sclerosis is probably the best described example. Women who have been diagnosed with MS prior to pregnancy will routinely flare right after they deliver the baby because of the loss of that progesterone signal.
Hmm.
And the same is true in menopause. Again, I see it in my experience as a revealing. The blanket, like you said at the beginning, is pulled off, and now we
Mhm.
see the evidence of the disease, which our hormones were so magically correcting.
What about the use of GLP-1s? Whether it's for someone who's has it covered by insurance or they're paying out of pocket. A lot of midlife women are turning to GLP-1s either because they should, in terms of type 2 diabetes or obesity, or they just aren't happy with the 10 and the 20, the 30 pounds, and they cannot get it off of them.
So we use GLP-1s in my practice, mostly for people who are very overweight or very insulin resistant, have a lot of metabolic dysregulation. We use them a lot. I hesitate to use them in patients who just need to lose 10 or 15 pounds,
Mhm.
but I do use them, particularly if someone has a lot of inflammation, or, because in many people, the GLP-1s are almost magical in reducing inflammation. But again, I'm always asking that question, why is that? Because our body optimals, better said, GLP-1 response that doesn't require any medication, injections, pills, or anything, right? And why is that dysregulated? The primary driver of that is microbiome, because we have all these bacteria species that are really good at regulating the response of GLP-1s and other hormones. And this is proven with fecal transplant. I don't know if you've seen the fecal transplant data, but
Mhm.
if you transplant the microbiome of a healthy, optimal metabolic animal into a fat animal, that animal loses weight.
Yeah, it's really incredible.
Yeah, and it's because of the microbiome, but the microbiome is being affected by chemicals and infections.
So if a woman comes to you and she's in the menopause transition and she's just feeling really terrible, there's a lot of symptoms going on,
Mm,
and one of them is her weight gain.
mm,
While you're asking her the question of why this is happening to this patient, we also introduce menopause hormone therapy if she's a candidate, if she wants to do that, and possibly a GLP-1, and still be on the hunt for what is the root cause of what's going on with her? Or are these separate buckets and you can only really do one at a time?
No, 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 always at the same time. And
Okay.
every person has individual unique risks and benefits and preferences. So sometimes I use a top-down approach and I start with hormones right away.
Hmm.
And we just begin to manage those symptoms, which with the most powerful medication we have. Estrogen and progesterone work, and we use bioidentical hormones, and people feel great. Many people would prefer to go bottom up, And so I use natural herbal lifestyle, food, those things. And we do sometimes manage the symptoms completely without having to put people on hormones and everything in between. So it just depends on the patient preference, on their presentation, their, philosophy.
Mm-hmm.
And like I said, I'm willing to do anything for my patients to feel better because quality of life trumps everything.
You're
Every
really meeting your patients where they're at.
Yeah, everyone's a little bit different. It's very right.
Mm-hmm.
I have a very individualized approach for my patients. I have three nurse practitioners that work with all the ladies in this stage of the game, and it's a beautiful thing. And people find their own path with using the lowest effective dose of whatever thing we need, and that includes GLPs. I do try to get people off GLP therapy, injectable GLP therapy, as soon as possible, just because of some of those long-term risks, or unknown risk is probably the greatest risk for long-term use. But any medicine is reasonable, and if it works, we keep using it.
When you get them off the GLP-1, do you see their weight come back on?
It almost always a little bit comes back if they haven't dealt with causes.
Mm-hmm.
So look, what's causing if I had to pick one thing that's causing the metabolic dysregulation in patients that are struggling to lose the 10 pounds, the 15 pounds, or the 150 pounds, if I had to pick one thing, it's chemicals. And there is no test for these chemicals. The obesogens and the endocrine disruptors in the environment are everywhere. If you do the scientific testing, which we don't have available clinically, but 100,000 chemicals we're exposed to every year. And that's what's creating the microbiome disruption and the metabolic disruption that's creating all this obesity and metabolic dysfunction.
So I find that really fascinating. And I also know that a big part of if we're talking about younger men, it explains a lot about erectile dysfunction as well, or a lower sperm count. So it's affecting men and women. But if there's no clinical testing and there's no way to really figure out what chemical or how it's manifesting in this woman's body that's making her gain weight or making her have the inability to lose the fat, where do you start?
Yeah, it's a great question. This has been the benefit of my experience because at the beginning of my root causes medicine career, I got the benefit of seeing patients with complex, terrible, critical illness that nobody could figure out. They didn't have a name for their disease. Nobody knew what was wrong. They're just like almost dying in front of our eyes.
Mm.
When I didn't know what else to do, and I just aggressively detoxified them, they all got better. And so I'm biased by that experience, but the thinking and the choosing are the most important things. So believing that what I'm saying is true, once that happens and we just choose a course of action that nourishes my mind, body, and spirit and detoxifies my mind, body, and spirit, and we just keep doing that over and over and over again, people get well. And I don't need the testing. It's not available. And I've done some really expensive scientific testing on myself and some of my patients to just prove this to me. And you would be astonished at the chemicals that are in our bodies that are disrupting all these little processes. And we have control over it. And so yeah, people get well when we do that over and over and over again. And we just start somewhere, right? We start and we keep doing it.
This is fascinating to me, and I need to know exactly what this might look like. So, can you present us um, a female client or patient rather, who is in her midlife years where this was the approach you took, and
Hmm.
what would that even look like?
Yeah, so the process for almost everyone is the same, and I created this framework to empower people to be their own instrument of healing. So there's 5 steps to nourish, 5 steps to detoxify, and that's 67% of everything. We just put everybody on these baby steps of nourishing our mind, body, and spirit, and detoxifying mind, body, and spirit. And you do that over and over and over again. So nourish, detox, and the third part is target. So everybody's targets are different. We'll change targets based on labs, based on risk factors, based family history, and all this stuff. But the plan for everybody is nourish, detox, target over and over and over again. So the 5 steps to detox, this is super important, because if I can get these 5 baby steps people doing, they don't need me, they don't need any provider. It's real simple. You have to move your bowels every day. You have to move your body every day. You have to sweat almost every day. And you have to bind chemicals. We have to use specific binders to bind up the chemicals that we're exposed to that you can't get away from. So that's 4. And number 5 is reduce the toxic load. So we're going to move our bowels, move our body,
Sweat.
bind, and decrease the number of chemicals that I'm consuming.
Okay, I do the first 3 every day, but I don't know about the second 2.
So binders and decreasing toxic load.
Mm-hmm.
Yeah, so binders saved my life. I was mercury toxic. My dentist filled my mouth up with mercury fillings, every single molar and premolar, prophylactically. And so I was poisoned by mercury my whole childhood, actually, accidentally. And then my dentist did that. And my IBS and my seizures got really bad after that mercury exposure. So binders have saved many hundreds of my patients' lives. And everybody has to be taking binders every day. Now, the good news is binders are everywhere. So probiotic rich food, fiber rich food, these are probably the best binders there are, right? The microbial cell walls of lactobacillus and bifidobacteria and all these other healthy gut bacteria in fermented foods, fiber and citrus pectin, these are food sources of binders that are binding toxins up in your bowels so that they never get absorbed. Does that make sense?
Makes total sense.
So everybody needs to have a bowel filled with binders. I eat a little piece of orange peel every day, with almost every day, and then I eat the orange. And the white part in the pith of the orange peel is a very good binder. So it also makes the orange taste delicious. You have a little bit of that bitter rind, and then the orange is sweeter. So I do that.
Wait, does it count if that bitter rind is in a cocktail? I'm not an alcoholic drinker, but I know that those are really beautiful, and they're in cocktails when you go on vacation.
I would count it. Yeah, I would count it.
Okay, good. Okay. No, it makes so much sense.
Yeah, so because like right now we just breathed, and that air contains cadmium, aluminum, mercury, brake pad dust, tire dust, in addition to whatever else they're spraying out there, and you can't get away. And when your liver sees that, so our blood absorbs that toxin, and it goes to the liver sees it, it pushes it into the bowel as quickly as it can.
Right.
And then you want to have a binder in there. So the readily available binders are food-based binders that I just mentioned. And then I rotate people through charcoal and clay and fulvic acid, humic acid. These are soil-based binders. And all the way up to, I have some special products that we make that are binders for real sick patients. Right.
What about supplementing with like a spore probiotic or just a probiotic?
It's a great, particularly for people who have microbiome issues or ga- gastrointestinal symptoms. Absolutely. It's a great binder. The nice thing about probiotics is that they also bind mold toxin. So mold is a major problem now, and anything that binds these things, we just want to have them in our bowels all the time.
Yeah. So if some women experience changes in their microbiome in the perimenopause and they have loose stools, and then if we're going to circle back to people who are taking GLP-1s, they might have constipation.
Mm.
So these are two areas, two opposite sides of the fence here to really consider when you're talking about having a bowel movement.
Yeah, anytime if somebody has the side effect from GLP-1s of really slowing their bowels down, I
Mhm.
really try to lower that dose,
Yeah,
and we have to manage the bowels because slow bowels is an absolute no in this day and age.
yeah.
And we see so much SIBO, small intestinal microbial overgrowth, um, and the being constipated dramatically increases your risk for chronic disease because that's the primary way we detox.
So I'm trying to think of all the daily little habits that I've put in place to reduce as best as possible.
Yeah. So, and again, it's just choosing to do as much as we can without stress. This is part of emotional detox.
Right.
Stressing out about all of it is sometimes worse than just not worrying about it. But yeah, the chemicals are everywhere. So whatever we drink, we eat, we breathe, and whatever we put on our skin. And I'll focus on that topical, the cosmetic stuff with many of your clients and your audience. The chemicals are in those cosmetic products like crazy. And almost everything that you put on your skin, if it's not specifically stating it doesn't have it in there, it probably has oxybenzone or what are the other SPF chemical sunscreens in it. And
Hmm.
that is a known hormone disruptor. So really looking to get clean products on your skin would be a primary way that I would have your audience reduce their chemical exposure because the skin is a very absorptive organ and it's all getting absorbed.
Oh my God, Dr. Guillory, I'm like laughing inside right now because I've been on this journey at 58 years old of applying a little bit of makeup. I grew up in a barn. I was always around horses and dirty, and that I was just a total tomboy. But now I'm on camera a lot and I want to just look better, right? I feel great and I want it to match the outside. But sometimes the natural skincare products aren't really as great on your skin. They don't feel as great. They're getting a lot better now. But I don't know if women are always thinking about that when we're buying products, when we're buying skincare and makeup products. And it's a good reminder what you're saying, but it is hard to navigate that because we want to get products that really do the job.
Right. It has been a very difficult thing to navigate, honestly. And
Yeah.
I have a daughter who's 21. She just had our first grandbaby, and so she's
Oh.
very interested in having healthy, vibrant looking skin. So that's an area of curiosity. I'm trying to curate a list of really, really good products. I don't have
Mhm.
it done yet, but the point is just do the best you can
Yeah.
with the products that you can use, particularly the ones that you slather in large amounts. Um, if you're using a lotion all over your whole body, you really want that to be clean
Yeah.
because that's a lot of exposure potentially.
Yeah, yeah, I agree. I always look for the paraben free and all the top chemical free. And there's apps to use, so you can whip these apps out on your phone and while you're shopping and scan them and see where they fall on the safety and efficacy for your skin. You mentioned sunscreen and SPF. I'm a melanoma survivor, and so I actually use European chemical uh, sunscreen because their filters are much better for removing and blocking UVA and UVB. The American ones don't have those filters.
Yeah.
But what I'm hearing from you is maybe all chemical filters would be bad, and therefore to maybe use the mineral-based ones.
Yeah, so specifically on sun exposure, there's some really good data showing we need appropriate sun exposure. We don't want to be scared of the sun. We want to have an appropriate respect for the sun. And I do for short sun exposure periods, I don't recommend any um, sunscreen. And if you're going to be out in the sun for hours, then mineral based sunscreen is my preference. Just because the chemicals, I would agree with you. The European chemicals are way better. They have banned most of the dangerous chemicals that we have not banned and that are everywhere in the US. But my preference would be to use mineral sunscreen. Yeah.
Hmm. Interesting. Okay. All right. Well, so is that it about the reducing our toxic load, or is there anything else before we jump into the rapid fire?
Yeah. So for detox, you definitely want to drink the cleanest water you can drink. So
Yeah.
tap water is not adequate. It's really causing trouble. So whatever water filtration system you can get, including a shower filter or a whole home filter, because your skin is absorbing that chlorine and
Hmm.
chloroform and bromoform that's in the shower water. You want
I
to
have a shower filter, by the way, and we have a water filter. And I have a shower filter because I am genetically predisposed to hair loss. And I've been on a hair loss to hair growth journey for almost 30 years. And the chemicals that come out of the Chicago pipes are detrimental to my hair growth journey. And so I change out my filter every month.
I'm so glad to hear you say that.
Hmm.
The tap water is causing lots of trouble.
Yeah.
And so yeah, so getting the purest water you can and decreasing whatever exposure you can get by eating the most organic, most
Hmm.
local, cleanest food you can get and the cleanest cosmetic products. So that those are the 5 baby steps of detox.
Yeah. I love it all. Problems that arise are when you want to go out to dinner. I love cooking at home. I cook all organic and grass-fed and all that stuff, as much as I possibly can. And when I go out to dinner, it's hard for me to just sit and relax and enjoy the meal because I don't know really what's going into it. But I am getting better about that because I do think you have to have a healthy balance of the control you can control in your home, and maybe a little bit when you're out of the home, but you also have to balance it with a little bit of just enjoying life.
I totally agree.
Yeah.
I have very sensitive, gut because of my history as a patient. Um, And so, but when I go out to eat, I just don't worry about it. And
Right.
I fast when I go out for more than a day. I fast a lot on either side, and
Ah,
that bowel rest covers a lot of wounds if you get some bad food.
detox cleanses and juice cleanses, real or hype?
Mostly hype. So, I would say that detox cleanses and particularly juice cleanses are largely more harm than good because detox has to be a daily part of everyone's life. Many people will notice a juice detox will make them feel terrible. Have you ever done that? Have you ever done a juice cleanse? Okay.
No.
Yeah, so many people notice that. And the reason for that is juice cleanses activate phase one detox and deactivate phase two, which is a terrible idea in your liver. And what phase one detox does is it makes toxic things more toxic. So juice cleanses can actually be harmful to people who have a big toxic load. And, I did a juice detox many, many years ago and felt terrible for a week. And that's when I started diving into the research. It's just a bad idea. We have to make detox a daily part of our life by doing those 5 things.
You just saved women a lot of money. So thank you for that. What about colonics?
Now, colonics, I have 2 colon hydrotherapists in my office because colon hydrotherapy is a very powerful tool for the right patient. Um, I use them in my cancer patients for our intensives. We have people that come for a few weeks at a time. when they're trying to really get on top of their cancer. And we do a lot of colon hydrotherapy for them. And then for people who are chronically constipated, it can be really life saving. um, and for some liver patients, the colon hydrotherapy is magical. For average healthy people, I much prefer to use food and targeted supplementation to just make sure everything's going.
What about IV vitamin drips for wellness? I get so riled up when I live in downtown Chicago. There are these Medi-Spa pop-ups all over the place. Every, four on a block. And they all sell very expensive IV drips, for wellness and hangovers and this and that. And it's going to grow your hair and makes all kinds of promises. And women, again, feeling so bad at this stage in their life, just and because they can't find good menopause care, they
Mm.
turn to these other options.
Yeah, so I'm not a huge fan. I'm a huge fan of freedom, but I'm not a huge fan of all these med spas providing what is essentially medical care without an assessment. So that bothers me. Like someone needs to be assessing the risk and the benefit of some of these treatments. So that really bothers me. But the benefit of IV nutrition is well established clinically, not with data, but clinically in the right patient, right? So people who, I'll give you a great example. I have so many people who drink so much water now. There are people walking around with 2-liter water bottles and continuously drinking water. We don't need that much water, free water. We are diluting our minerals, diluting our electrolytes and our salts, right?
Yeah.
And so I've had many patients that's the cause of their migraine or the cause of their fatigue. And so we do IV hydration and minerals, and in a week they're better. So in the right patient, IV hydration is great. Most of these places are probably not doing much good, particularly for the menopausal or perimenopausal woman that has a lot of symptoms.
Yeah. Especially when it comes to NAD IV infusions. That's another
Yeah,
one that
yeah.
just really irks me.
NAD is really effective for the alcoholic. It
Mm.
works wonders for people who want to recover from alcoholism and prevent the cravings associated with that.
Mm-hmm.
Um, there are better ways to get NAD support than a 8-hour IV.
Yeah. Yeah.
Yeah.
You mentioned heavy metal detox somewhere in this conversation earlier, and I wanted to know your yay or nay on heavy metal detox protocols.
This is a great question. So, my belief and my experience is that almost every person in the Western world is heavy metal toxic, and we have to do something about it. And this is from testing lots and lots of people. Um, Really important caveat. I see tons of people who are really sick who get some metal testing done, and the metals are showing low, like they don't have any heavy metal problem. In patients who are sick with a chronic complex disease, the sickest patients have the lowest level of heavy metals in their testing because the heavy metals are all in the tissue rather than in the urine or blood. Does that make sense?
Yeah.
So the
Yeah.
most important thing is the interpretation of the testing. Those 5 steps is a very good way to decrease your heavy metal burden and your exposure. So, and binding is a great way to do it. I use some special binders, and sometimes we have to do high level aggressive heavy metal detox. That's just true. That was needed for me because I was mercury toxic. Many patients don't need the high level stuff.
Would somebody be walking around with a symptom of heavy metal detox specifically, and what would that look like?
Yeah, so real commonly, fatigue, chronic fatigue, inexplicable long lists of symptoms, very common related to the combination of toxins. So very small levels of multiple toxins are synergistically toxic. So a little bit of mercury and a little bit of lead and a little bit of cadmium are terrible together because of synergy. And this is proven out to me in my experience. When I didn't know what to do, when I aggressively detoxified people, they all got better. And so particularly for chronic fatigue.
I mean, every menopausal woman feels chronically fatigued, right? Every young mom feels chronically fatigued. Um, and also chronic fatigue also is a symptom of a woman having like a heart attack.
Sure. Yeah, absolutely. So again, the important thing is just to think about these things broadly and work
Mhm.
on the things that we know work. When you nourish your body, because I have this belief and experience that the body is intelligent, wise, and is serving my interest. If I nourish and detox over and over again, people get well.
Mhm.
So, but it does come to that fundamental belief, right, that the body is created to heal.
I mean, your points of nourishment and your 5 points of detox, these are not like crazy things that we have to do. These are just pretty basic
Pretty
things.
basic. Yeah, doing them over and over again
Yeah.
consistently is far more effective than going to get some detox kit or an IV med spa. Like I try to keep people out of my IV room because if I can just get them to do a little bit every day, I
Mhm.
sauna almost every day. Like sweating is an essential piece of life in the world for people that don't want to have a chronic disease because that's just one of the really essential ways to detox. So just doing these things over and over again is dramatically effective, even in patients who I only see once. If they can't afford to come to my office, I just give them that protocol. Do it over and over again,
Right.
and you can get well because the
Uh,
body is magic.
What you're talking about is just creating a really healthy lifestyle and and committing to it every single day. And I always tell people, every morning you wake up, it's another opportunity to do all the things that are important for you. Right.
That's what,
And if you forget one or two of them, the next morning you get to wake up and you get to try again. And we just keep practicing.
exactly. And that really essential piece of nourishing my mind and my spirit and
Mhm.
detoxing my mind and my spirit, that is really, really key because the worry, the frustration, the anger, the resentment for these entities that are spraying our food with chemicals, that'll kill us and harm us much faster than just peace and gratitude and
Yeah.
a daily practice.
100%. Meditation is not for everybody, but mindfulness is something that is much more attainable. And I think a great place to start. Like, I don't meditate. It's really hard for me to, I've tried it on and off for many, many years. But mindfulness, I have a practice, and that one I can take with me wherever I go. So if you're not someone who can really wrap your head around meditation, mindfulness has a lot of research behind it.
Absolutely. I've done
Yeah.
every version of meditation. And I think the thing I had a patient yesterday that I saw that was really struggling with this. Like, what do I do with this anger and resentment and worry? She was a cancer patient, hormone sensitive cancer patient. And the easiest mindfulness practice that I have people do is I have them say what they're feeling out loud. Like, I am worried about my cancer coming back because of these hormones, whatever, say it out
Mhm.
loud
Mhm.
and feel that feeling and then transform it into gratitude. So just saying, I'm going to direct all of my energy of frustration for this worry for my cancer into being grateful for my daughter and
Mhm.
for my daughter's hair. I'm going to be grateful for it, right? Just saying it out
Mhm.
loud
Mhm.
is
No, I
really
agree.
is really powerful
Yeah.
mindfulness practice. Yeah.
My mom is a two-time cancer survivor, and she had bladder cancer this last round, breast cancer before that.
Wow.
And yeah, and she's 85 and she lives a very healthy lifestyle. She moves every day. She has a bowel, moves a bowel every day. Um, what else is on your list? She takes a
Sweat.
probiotic.
Yeah.
She
Fine.
exercises. I don't know if she sweats every day, but maybe when she sweat today, she told me she went on a nice long walk and she sweat. Um, but the words from her oncologist of "you are cancer free" somehow cannot make it inside her. She doesn't believe it.
Oh, wow.
Yeah, because she asked, "Am I in remission or am I cancer free?" He said basically the same thing, but you are cancer free. You can tell people you are cancer free. You are free of cancer. And she worries so much because she's had it twice and she's
Mm.
85 and she just worries that's what's going to kill her. Um, and I've tried to share with her about mindfulness, but it's really difficult for her. But this is an example of that toxic way of thinking about your body not taking care of you that can cause problems down the road.
It's true.
Yeah.
And we just have to convert that energy of
Yeah.
worry into sound, I think is one of the most powerful ways.
Yeah. Yeah.
Speaking it out loud. Yeah.
Yeah. Dr. Guillory, if you could eliminate one wellness trend that's actively harming midlife women right now, just one, what would it be?
Without question, it would be the yoga pants and shirts that look so beautiful but are covered in forever chemicals. There's
Ah,
so many healthy people, health conscious people walking around in those beautiful yoga clothing, and they're coated in PFAS and other related chemicals. And we should never be wearing those chemicals next to our skin at all, but especially when we're sweating, because they do get absorbed through the sweaty skin.
that makes so much sense. And I was not expecting that answer. But
You
that's
just see
what,
them, you see them everywhere. I mean,
yeah,
in the healthiest at Erewhon in California, the healthiest
yeah,
grocery store there is, there are women coming from yoga class covered in chemicals.
yeah. Well, where can women find you and Root Causes Medicine?
So I have two websites, rootcauses.com, root causes with an
Mhm.
s.com, and rootcauses.org. So those are the two best places to connect with me. The .com is the clinic, and .org is my foundation, and you can get access to the movie that I made. There's a trailer there for one of the movies I made, and access to my book that's coming out next year. So rootcauses.org and rootcauses.com.
Perfect. I will put all of that in our show notes. And it was so wonderful having this conversation with you. I think it's really important to bring other perspectives, especially when it comes to women's health and the menopause transition, because there is no one size fits all approach to any of this. And some women have a belief in doing something more root cause. With a root cause approach versus just taking medications. And so I believe women should have a plethora of options to peruse. And you eloquently shared with us another way of looking at a menopause transition. So thank you for that.
My pleasure. Thank you so much for having me, Jill.
Yeah. And thank you for everyone tuning in. And until next time, we'll see you. Thank you for joining me. I hope you enjoyed the podcast. Lifestyle changes can be hard and overwhelming to make. By building your support team of functional medicine doctors, therapists, and health coaches, you can reach your optimal health goals. Be sure to check out my other podcasts. Until we meet again, stay healthy.